Welcome everyone to Westminster's Peace and Justice Workgroup Thursday class series. We're excited tonight to have a couple representatives from the National Poor People's Campaign to talk with us about a couple different reports that they've issued in recent months. One about low-income voters and another related to COVID. So we're excited to have them present this evening. We have two folks with us. We have Shailly Gupta Barnes, and she serves as a policy director for the Cairo Center and for the Poor People's Campaign, a national call for moral revival. She has a background in law, economics, and human rights. For over 17 years, Shailly has been involved in building a movement led by the poor and dispossessed. She's written many policy documents with the campaign, including Souls of Poor Folk Audit, Poor People's Moral Budget, and most recently, the Waking the Sleeping Giant report and Poor People's Pandemic report. We also have with us Tony Eskridge, who serves as the Policy Program Associate for the Cairo Center. A recent college graduate with a background in urban studies and political science, Tony is committed to centering the needs and dreams of oppressed people in policy conversations. He believes a movement led by the poor can build the power to transform society. We're so glad to have you both with us, and I'll let you guys take it away.
Thank you, Lynn. We're really grateful to be here with you all today. So I'm the policy director. I've been with the Poor People's Campaign since it began, and then for maybe 10 or 12 years before then was working with Reverend Liz, Theo Harris, and others across the country to build what eventually, forms the Poor People's Campaign with Reverend Barber and his network coming out of North Carolina and the Moral Mondays movement. I thought it might be useful actually just to review some of the policy approach, how we approach policy in the Poor People's Campaign, why and what it means to kind of center poor and low income people, and then kind of go into some of the key findings from our voter report and the pandemic report. And Tony will also, share different parts of the reports with you all tonight. Does that work? Okay, great. So just as an overview, the policy approach of our campaign, where our demands come from, which even if you've been part of I don't know if you all have been part of the Delaware campaign for a while, but it's a good reminder that, what we are calling from this campaign has come out of years of reconnaissance and relationships and organizing across the country. We launched this campaign in 2017, in December 2017. And in the years leading up to 2017, so both in 2016 and in 2017 into 2018, we were on multiple national tours, looking at the broader trends of the past 50 years and connecting what we were seeing across the country in different communities to what had been unfolding across the nation for at least 50 years, at least since the 1968 Poor People's Campaign. And so our approach generally is to connect the facts and figures and the faces together. So the first expression of our policy demands, of our demands of this campaign, are in the moral agenda. And we can point to almost any part of that agenda and tell you what community we learned that from, what community was telling us about what was happening, whether it's around immigration or housing or healthcare, education, or voting rights, or anything in there, the questions that it raised, and then how it informed the rest of our research questions and our agenda from that point. And so this is basically, our whole approach to policies, that it follows the conditions where people are at. It follows the organizing people are doing against those conditions. And that's, we kind of, are capturing the needs and the hopes, really, of the 140 million poor and low-income people in this country into a concrete policy framework for this Poor People's Campaign, but also a broader movement that we need, that can move our country in a better direction, which we really need right now. We've needed it for a long time, but the events of the past few weeks have shown just how just how terrifying and tragic the continuing failures of our policy makers are. So everything really draws back to that moral agenda. And King actually writes about this in 1967 as he's organizing with other poor people's organizations, the Poor People's Campaign in 1968, about how we can't put the cart before the horse, meaning it doesn't matter if you have the right policies or the right program. To have them actually turn into power, you need people. You need poor people, people who are impacted by the current failures we're facing, who are organizing into a new and unsettling force, as he described, to change this country. So our approach always begins with where people are at, and we use that to build out our work, not so that we can be right, but so that we can organize poor and low-income people into this powerful force to be reckoned with. And so that actually brings me to our first report tonight, which shows the political power of poor people, the Waking the Sleeping Giant, which is, we put this report out in 2021 after the 2020 elections, after the presidential elections in 2020, to mainly do two things. One, look at the impact of the campaign's voter outreach drive, which I'll talk to you about in a few minutes, in a second. And then two, just look at the impact of poor and low income voters. What happened in the 2020 elections? How did poor people participate? How did the poor and low income electorate participate in that election, given that some of their most pressing and key issues, health and economic well-being, these are two issues that we know from earlier research, poor people care about the most. We're on the national agenda for the first time in many, many years in a very different way because of the pandemic, because of the economic fallout of the pandemic. But what happened in that election and what can we learn from it? So I don't have a lot of slides tonight. I mainly have a few maps and images, that kind of thing. And Tony, I think, will put those up at the right time. But what we learned when we looked at the behavior and the participation of low-income voters in 2020 was that, so first, the Poor People's Campaign reached out to over 2 million low-income voters in the lead up to the 2020 elections. We focused on 10 key states across the country. We had identified those states based on their relevance to the election, states like Michigan, Pennsylvania, Wisconsin, but also Arizona, North Carolina, Florida, Texas, Georgia, states where actually, a small number of new voters, a small number of poor voters could change those outcomes. And, we reached out to over close to 2 million low income and low propensity voters, meaning that they hadn't participated in the past 2 or 3 election cycles. And what we found was, so all of our outreach was nonpartisan. We didn't say go vote for this or that political party. We said, do you care about the minimum wage? Do you care about the issues of poor people? Are you poor? Go vote. That's what we said. We reached out in Spanish, we reached out in English, and we reached out in ASL, in sign language, American Sign Language. And we found that of the 2 million eligible voters we reached out to, hundreds of thousands of people actually engaged in that election. In Georgia, we reached out to over 180,000 potential voters, and about 39,000 of those voters engaged in the election. That's 3 times the margin of victory in that state. And we saw this repeatedly across all those states that we reached out to. Now, we can't say we were the only factor in their participating in the election, but our analysis showed that we were a statistically significant and positive factor in people's decisions to participate in the election. So what that tells us is that if you engage poor and low-income voters around the issues they care about, they will participate in elections. Now, this is important because it's often a segment of the electorate that isn't appealed to. Either, a lot of get out the vote efforts or massive voter drives, the common knowledge is that you don't reach out to people who earn less than $50,000 because they're not going to vote. But our research shows otherwise. And in fact, the other thing we learned was that overall, this segment of low-income voters not only accounted for about a third of the votes that were cast in 2020, they account for about a third of the electorate overall. So out of the 150 some million people who voted in 2020, over 50 million were poor and low income voters. And among eligible voters, it's an even bigger group of numbers. It's about 80 million poor and low income voters in that, eligible voters in the broader electorate. Now, it's not organized. We're not saying that they all voted in the same way. We know they didn't. These contests were too close. But it shows, and maybe Tony, you could put one of the maps up now if you can share your screen. But if you see this map, it has the whole country in blue and in different shades of blue. And the darker the blue, the higher the percentage of low-income voters who actually turned out. So the darkest blue you could see is in West Virginia, where over half of the voters were poor and low-income voters. Now, again, we're not saying that they all voted the same way. You could see Delaware, it's a little small on the map, about almost 30% of the votes that were cast by low-income voters. They didn't all cast their vote for the same ballot, for the same candidate. We know that, but it shows that there is a power that could be really unleashed if there was an agenda, if these voters were organized around that agenda and around the issues that matter to poor people. So these are the issues that we are all concerned about. These are the issues that impact our lives. And it's up to us really to make sure that these issues are on the agenda in every political contest after 2020. Again, 2020 was a unique year. There was a lot of attention on the elections. There was a lot of attention to health and economic well-being. But it's up to this campaign. It's up to the folks in Delaware. It's up to the folks all over the country to make sure that these issues are on every political contest, that we experience, to get poor and low-income people organized, to take action together. So I might pause for a minute here, and maybe Tony can share with you where you can find this report on our website, and we can pause if there are any questions about that before we continue to the pandemic report.
Yeah, sure. Thanks, Shailly, for giving that overview. I feel like, especially coming out of the 2020 election and how crucial that was, and looking forward to the 2022 midterms and this potential that this campaign is building, and organizing around an agenda centering poor and low wealth people. Like you're saying, like, we can't say for certain what candidate a particular person voted for, but we do know that there's a huge voting bloc, and they're waiting for an agenda like the one with the Poor People's Campaign that actually puts them first. So anywho, let me show you guys how you can access this on our website. So if everyone can see, I've just went to poorpeoplescampaign.org. And if you go to the Learn tab, there's a little drop down. If you go to reports, it's the Waking the Sleeping Giant report. So if you just click that, it takes you to a page that has like an interactive way where you can see some bits of the executive summary, but also comb through the key findings and jump to different sections of the report. But to see the whole study, you can click any of these, but here, it'll come up. It looks like this. A lot of the points in this report, Shailly has already mentioned, but I'll show you specifically how you can comb through some of the state-specific data to Delaware, if you share this with your networks outside of the state, just how to access some of that. So it's all at the bottom in the appendix. Let's see here. It also goes through the methodology, of course. Yeah, so here are some of the tables. So this one's looking at just turnout rate and some of the percentages of looking at how Shailly was mentioning our voter outreach drives, kind of like the effect that not necessarily us, but just like outreach drives in general have had an effect on turnout rates. And then doing some more scrolling here, we get to some of that individual data, looking at the raw numbers of poor and low income folks in states, and also just percentages of those people that are registered that turned out to vote. So Shailly already mentioned it's almost 30% of folks that are poor and low wealth in Delaware. But going into those numbers even more, the registration rate was nearly 80%, the turnout rate being 56%, and then percent voted being almost 26%. So comparing that percent of voted to the percent total of who is in the state and the registration rates, we can already see that there's a huge potential if we can organize in our state specifically around an agenda that lifts from the bottom. And yeah, it goes into some of the other states as well, and also breaks down racial demographics if you wanted to keep scrolling and dig through that data as well. So all of that is here for you if you're interested. I also want to, on the topic of just some of the data that's available, Shai was mentioning a little bit, how voting is tied to so much else. So the Poor People's Campaign just over the years has put together a series of fact sheets that go beyond just voting, but look at they look at housing, healthcare, militarism, so much more. And we have a lot of these fact sheets also available. So the same way you would click on the Learn tab and scroll down to reports to get to the low-income voter report, if you go one step below and go to fact sheets, here's where you can get access to a lot more of these policy documents that we've been putting together over the years. There's a lot here, but I'll just go through a couple of examples that may be helpful. So if you scroll down just a little bit further on this page, there's a whole tab for state fact sheets. And this just gives a few points covering the whole gambit of what's affecting poor and low wealth people. So clicking on Delaware, you can see it goes into a lot of different areas of interest. So poverty data, this is based in 2020, by the way. So in 2020, 42% of people in Delaware were poor or low income. It also digs into environmental devastation, family and healthcare, a whole lot of things here. And then it gives a national scope. And like I said, this data is coming from 2020, and oftentimes there may be more updated data. And in a lot of these points, we have hyperlinked where we collected that source from. And oftentimes you can click that source and get even more updated information. So for example, let's look at some data on housing, for example. This point here, it talks about based on a 2018 minimum wage, it would take 100 hours of work to afford a 2-bedroom apartment. First of all, that's just insane to comprehend. And when we look across the country, there's nowhere a minimum wage worker can work full-time and afford a 2-bedroom apartment. Just insane to comprehend. Again, this data is from 2020. But if we click this source, it should take us to the Low Income Housing Coalition, where we get this information from. And it came from their Out of Reach report. But as you see, there's more updated information from 2021. And if we look at Delaware, let's see what's going on. Would let me go to the spot. Here it is. It's nearly unchanged. So a minimum wage worker would have to work 97 hours a week, the equivalent of $22.50 an hour to afford a 2-bedroom apartment. So just ridiculous. And again, so many of these sources are hyperlinked, and you can go in and do even more research beyond just the quick number that we have here. Also, if you're interested in going a step further, if you have a particular interest in just anything, like we can stay with housing, for example. It has a more national scope, but it's still helpful to dig into even more like what's going on like around the country and relating it to your own state. So if you have an interest in housing, there's a whole sheet for that. We have sheets for militarism, a healthy environment, even stuff on the COVID-19 pandemic. So there's a lot of stuff here for you to use, especially in regards to voting, but so much more. So yeah, we can even pause here to talk about questions about all of these things, and yeah, then we can continue on with the Poor People's Pandemic Report. Yeah, see, Roger has his hand up.
Part of what we did in Peace and Justice was read the book. In fact, the whole church did, The Sum of Us. And it was quite evident, and I think in the book and in our discussions, that people tend to sometimes vote against their best interests. And in other words, they will support, if they're poor, they may support administrations that refuse to bring Medicaid to a state, may not support a higher minimum wage. Do you have any comment on that? Is that a matter of education? Is it a matter of who is voting in that block of, let's call, we say, the poorer people, the lower income people? What's going on there, and how do we understand that?
I think our experience has been, so I mean, I can respond a little bit by sharing some of our experience and reaching out to some of these communities where people had been described as voting against their interests. And so for example, I think this was in 2019, we went to Harlan County, Kentucky. And right, and so poor, mainly white, and had voted Republican for many years, for many election cycles. And we went in, with some of the relationships that we've been building in the campaign for years. And we started talking about just the issues that people were facing. We talked about wages and jobs and housing and healthcare and, just what people were facing. And we connected what they were facing in Harlan County with kind of conditions across the country. And we presented, how the Poor People's Campaign, actually bringing people together around these issues, could change them. And during the course of the presentation, someone stood up and kind of explained, I was like, well, I'll be damned, they've been lying to us the whole time. And it turns out that, there hadn't been a Democratic politician who had visited Harlan County in multiple election cycles, maybe even multiple decades. And so there's, for the same reason that a lot of get out the vote efforts won't reach out to low income voters, for similar, maybe different reasons, sometimes Democratic politicians just will have given up on some of these communities, and not actually made the effort to go there. Reverend Barber tells a story of, going to a town in Appalachia, the Appalachian part of North Carolina, where they were facing a real crisis around education. Their schools were being closed and underfunded, and they had reached out. It was a Republican-led town, again, predominantly white. They reached out to the Republican Party in North Carolina about that crisis, and they didn't respond. Then they reached out to the Democratic Party in North Carolina, and they didn't respond. And then they reached out to the NAACP, because they had seen Reverend Barber speak to the crisis of public education. They're like, well, maybe he'll respond. And he responded. And he went to this town, and not only did they talk about education, they talked about healthcare. What he said was, are you all facing, a challenge with healthcare? They're like, oh, yeah, we are. And he's like, now you see, this can't just be a Black issue because most of you are white. Right. And so it's just actually kind of engaging with communities that people have made a lot of assumptions about, but building the kind of relationships to bring them in. That town ended up forming a chapter of the NAACP. So across North Carolina, there are a couple of these predominantly white NAACP chapters, and they're coming out of a real, let's say, maybe frustration or disaffection with the current political options on the table. And in some ways, the Poor People's Campaign is nonpartisan. We don't endorse candidates. We don't allow candidates to speak at our events, and we stand for an agenda that we welcome everybody to. We don't care what your political affiliation is, but if you are part of, if this resonates with you, we want you in this campaign. And so kind of presenting another way to move the politics of this country forward past maybe some of the limitations that have kept people who actually share common interests with people of different races and colors and ethnic backgrounds and gender and sexual orientations, but are led to believe differently by for many reasons.
And taking that learning, what is the best way to try to, fan that out across the country? How do you, engage in enough conversations in those communities where people are not going and talking about these issues? How do you, because, it's not like you can just do an advertising or marketing campaign to reach them. It's doing the hard work of the conversations in so many places all over. How do you go about doing that?
I mean, this is the spade work that civil rights leaders of the past talk about. It's spending time building relationships, committing ourselves to what will be a very long road ahead. But we, this campaign has been around now for about 4 or 5 years. We may have 4 or 5 years yet to go before we kind of break through some of the narratives that keep us out of the mainstream media, before we break through. I mean, I know that in North Carolina, it took several years before they were able to kind of achieve the mass and the kind of attention they got by 2014, where, tens of thousands of people were marching down the main streets of Raleigh, North Carolina, united around this agenda, united around an agenda that many people could not. It was the largest largest march in the South since, I think, like post-Civil War, and no one had expected that kind of activity before. But it takes time, and sometimes it takes time just to set up, to be ready for whatever is going to happen next. So now, after 5 years, we have this infrastructure across the country, 40 state coordinating committees that are building relationships. We're mobilizing towards June 18th and reaching out to all of our networks to again try to build momentum, bring more people in who can then hold this in their communities. We need every single every single kind of church and public school and library and any kind of public institution that exists to have someone who's aware of the Populist Campaign. We're not there yet, but in some places we are growing. And even in these few years, we've been able to shift some of the narrative. We hear more about poverty in politics today than we ever have. The fact that the child tax credit was even on the agenda for the past couple of years, and voting rights in the way that it has been. I think, the language around morality and war, all of these things, at this being talked about together, I think is some reflection of the influence the campaign has had. But that influence, again, we can't put the cart before the horse. For it to actually go somewhere and not stay in words only, to have it translate into deeds takes people, it takes leadership, it takes, it's a long haul that we're on. And sometimes things happen fast, right? We have to be ready. So it may be that this violence in Texas and in the Bronx, or and in Buffalo, thank you, and in Orange County, maybe that jumpstart something new, right? But we have committees across the country who may be ready to play the role that we can play as the conditions compel us to.
Yeah, I feel like Shailly and everyone has like already said so much, but I feel like I can even chime in some. Just I feel like your questions are just like both connected, and what we say in the campaign, even as we're like organizing to June 18th, like we're never staging actions or creating documents or marching for like a moment. It's not, we're organizing towards one thing. We're really committed to building a movement. So it's not where one major event happens and then we get angry and assemble for one thing to talk about what's going on and then return until the next thing happens. And I'm a young person, like just getting more involved in the work, but especially leaning into leaders like Shailly and Reverend Liz and Reverend Barber and Dr. Sharon and so many other folks with Kairos and in the Poor People's Campaign. They've been building this movement and following a tradition of people who have been involved in this work for decades, who are committed to building this infrastructure so that as folks become more aware and as folks do that inner work and start questioning some of the narratives that they see in the media or in their own lives upon reflection or their own experiences with poverty, there is a movement, there is people who are organizing and having these conversations already and who are with open arms saying, join us and get more involved in this. And I feel like even also connected with this in terms of how do we like have these conversations, it's all about just like changing the narrative. I feel like that's so central to our work, just like understanding what the narrative currently is and then really going deeper and being like, well, why is this narrative? Like what's really going on down deeper here? When we think about how we pit immigrants against folks who are here already, it's like, oh, they're stealing jobs. Well, when we really dig deeper, that really doesn't make sense. And we see that they contribute so much to the economy, but are completely barred from government assistance almost all the time. We think about young folks who are quote unquote asking for handouts, and why are they asking for a living wage? Why can't they just work hard and start out at the bottom like we all did? But we're totally ignoring the fact that mental health rates, especially for youth, are higher now than they ever have been, and the rising cost of education and just growing up in society today. Folks trying to afford their first apartment or buy their first home. It's so much more difficult now for young people than it was then. So all of these narratives that we see that put us against each other, especially poor and low people against each other, when we really dig down deeper and see what's really going on here, we challenge that narrative. We have these conversations in our own community, and then the ripple effect starts to happen.
So I wonder if we should continue on to the pandemic report. This, again, I don't have too much to show on the screen, but on this question of health and economic well-being, and as we pass this really grim milestone of 1 million deaths from COVID-19, we have the second highest death rate among rich countries in the world, and so we developed this report because we knew that poor people and poor communities were being hit very hard. We had heard from people like Olivia Womack in Mississippi, who lost nearly 24 members of her family. There's a woman, Rachel, in DC, who every week for at least 70 weeks lost somebody. That level of trauma, that level of death, right? I mean, I'm sure some of you have had similar stories, maybe not to that degree, I hope not. But essential workers like Claire Chadwick in Kansas, who got COVID at a big box store, didn't have paid leave, couldn't test, all of these things. But so we knew this was happening, but there was no information or data that was being collected and disseminated in a regular way on poverty and income in the pandemic. You could get information on race, on age, even on gender to some degree, but not on, and geography, but not on poverty. And so we approached Jeffrey Sachs, the economist Jeffrey Sachs, who was willing to turn the capacities and resources of his network to work with us. And so we worked with a team of analysts and data researchers to put this report together. And as with the rest of our policy work, it was organized around this question about, what is happening to poor people in this pandemic? How is poverty and income, how is that playing out in terms of death rates? And we gathered information at a county level for for all the counties in the country, so for 3,200 counties. And we divided those counties into groups of 10. So Tony will show you the tool later, but you could look at your particular county information, But to look at trends, we had to look at all of that information together. And so we took one step back, we divided all those counties into groups of 10, and then we saw into groups of 10 by income, I should say. And so, the number 1 was the richest county, number 10 was the poorest sets of counties. And what we saw was that the poorest counties in the pandemic had twice the death rates of the richer counties. So Tony, maybe you could pull that slide up, that image. Okay, here we go. Not the one before that. Yes. So this top bar graph, the top bar. So these are the 10 income groups. You can kind of see it's very small, but the bottom, the one at the very bottom is the poorest, the lowest median income per county, and the one at the top is the highest median income in terms of county. And you could see that the deaths accumulated over all different phases of the pandemic is half the deaths. The deaths at the top are half the death rates as the lower income counties. And in fact, when we looked at this over time, and so we can go to the next slide, we can see that after the first phase of the pandemic, every other phase hit low-income counties 3, 4, even 5 times as hard as richer counties. So the yellow line maps low-income death rates, and you could see the first phase, it's down at the bottom. But in every phase, the second phase is basically just hitting low-income counties. The third one, so this is the third one is the winter surge of 2020. That death rate, I believe, was 3 times higher in low-income counties than it was in richer counties. The deadliest phase, which was this phase, and then the last one over here, Omicron, that had the death rate that was, this was 4.5, this was 3 times higher. And then the Delta death rate was 5 times higher among low-income counties than it was in richer counties. Now, we can't explain this by vaccination status alone. More than half of these poorest counties received both of their shots. It is a lower vaccination rate than richer counties, but that's definitely not the whole picture. It doesn't explain this whole discrepancy, 3, 4, 5 times discrepancy. It doesn't explain that. Some of the other factors that we saw when we looked at these low-income counties was that they have twice as many people that are uninsured. And so that may have something to do with it. Among the 300 counties that had the highest poverty and the highest death rates, more than half of them were in states that had not expanded Medicaid. So clearly there's some relationship there between not having access to healthcare and what happened in this pandemic. But what this allowed us to do when we see the information like this is to, again, shift the narrative away from individual behaviors, right? We're going to hear a lot. We've been hearing a lot about how, people are choosing to put themselves at risk if they're not getting vaccinated. Now, vaccinations will protect you to some degree, but they don't explain these big discrepancies in death rates that poor counties have been experiencing. But what make it closer to that are the policies, the public health infrastructure, the housing infrastructure that exists or doesn't exist in these places. And maybe it starts to remind us that, these are policy decisions that are made for people that they must live through rather than, and then, once those decisions are made for them, then we're making the best choices we can within the framework that's given to us, right? And so the other thing that I wanted to say was that, even that poverty, the other thing we saw in this report was that poverty is truly endemic, like widespread. Every county in this country has close to 10% of its residents who are poor, low income, at least. Even the richest counties have almost 1 in 10 residents who are poor or low income. And that goes up to 94% in some places. So, there's more to say about all of this, but I wanted to hand it back over to Tony to maybe share some more details on the report, where you can find this information and look at your state data as well.
All right, thank you again, Shailly. Here, I'll share my screen again. Okay, so I'm back at the main site. Same thing as before. You go to the Learn tab. It's our latest report, so it's right here, the first tab underneath the Poor People's Pandemic Report. I'll show you how to engage with the page itself because there's so much more information here than just like the interactive dashboard. But first, I wanted to show you that dashboard and how to really dig into state data, but also county level data for Delaware. So there's a lot going on here. Towards the left side of the screen, we have filtered out the top 300 counties. And as Shailly was mentioning earlier, poverty is everywhere. There's not one particular region or part of the country that experiences it more. It's widespread. And if you were to even scroll through these 300, you would see that these states are everywhere. We go from Virginia to Georgia to Texas, Kentucky. It really is everywhere. And in the middle, it's the whole country, not filtered out yet. Everything is color coded. So, you know, the darker red regions are the low income and high death rates. And you can even see like some higher income places still had high death rates. So if you wanted to filter down to your state and possibly even a county, there's a way to do that on this top bar. It says select state. So I'll go to Delaware. You can already see it's already filtered it down a lot for us. If you wanted to go even further, for states with, you know, dozens of counties, it's especially helpful. But here we just have the few. So for example, if we look at Kent County, Delaware, it's highlighted here. So looking at the color code, it experienced a high death rate. And if you click on the county, there's a lot more information here besides just looking at COVID death rates. So we see here, we see the cumulative deaths. We also the death rate, which is already seeing like a lot higher than was seen in a lot of other places. And here's the interesting thing. We have median income was nearly 61,000. Despite that, the number of people, the percentage of folks living at or below 200% of the poverty line is still 32% almost. That's almost a third of the county is poor, low income nearly, despite having a median income of nearly 61,000. That's really significant. And it's also not unique to Kent County. We can see that in multiple places. Also percent uninsured, 7%, very significant. Percent of folks who are rent burdened or paying more than 30% of their income. That's a marker used by a lot of economists because if you're paying more than 30% of your income on rent, that leaves less money for families to spend on utilities or food, childcare, healthcare, so much more, transit, so many things. So the fact that over 50%, nearly 56% of the population is spending more than 30% of their income on rent is huge. Also police violence death rate, that's very significant here. And also the racial breakdown. Again, a third of the county is poor, low wealth. And despite how the media likes to racialize poverty, almost 62% of the county is white, compared to 25% Black, 7% Hispanic or Latino. And they have other racial breakdowns here, but just really significant here. And we can already see just from this one square that we clicked on looking at this county, how we're already challenging a lot of narratives around poverty and even COVID right here. So it's really easy to navigate this way. And even if you wanted to look outside of Delaware, you know, click a different state, click on a different county, there's a lot that can be done here. Looking back at this main page as well, there is a story map here, which kind of details the report, details the Poor People's Pandemic Report, but just in an interactive way that digs into a lot more specific numbers. So for example, you can click on race and poverty and see, let me scroll down so you can see more of the page, but we can see, for example, racial composition of counties. Each dot represents a different race, different color, different race. Different ways to visualize that, not just on an individual basis, but looking at countywide basis. Another thing that's really interesting to note, I showed you on the digital dashboard on the left side of the screen, the poorest 10th counties and how you could scroll through. But a quicker way to access those things is on the story map. If you click this poorest 10th tab, there's a map of the whole country here. And if you pull this bar, you can see the poorest 10th, which had the lowest median incomes and oftentimes some of the highest death rates. And as Shailly and I have both mentioned already, you can see on this map how poverty is really touching all sections of the country. It's not just limited to one place. And there's a lot more here that's really interesting to dig through, but you can dig through that on your own when you click on this tab. One last thing that I think is significant, also there are some more fact sheets looking at mass incarceration during the times of the pandemic and looking at how in prisons they experience almost 5 times the impact of COVID there than those of us not, which is just significant. But also getting at some of these narratives around who is poor, where are the poor, and why, and how we were impacted by the pandemic. We have some county snapshots that really do a deep dive in different regions. So we go from Mingo County, which is nearly 95% white, and so much widespread poverty and a huge COVID death rate. How can we go from a place like here to a place like the Bronx, which is very diverse, but still experiencing high death rates? And then we can even go out west into Gila County, Arizona, with high native population, and seeing how they as well had high rates of death during the pandemic. And even touching down into a place like Marathon County, Wisconsin, which had a relatively high median income, almost like here in the county I just looked at, in Kent, Delaware. They had a median income of $62,000, yet nearly 1 in 4 folks are living at or below 200% of the poverty line. So regardless of where you're looking, we can see just how poverty touches us all and how COVID did not discriminate, but our policies did. And this was truly a poor people's pandemic. And yeah, I can stop here just in the interest of time to get more questions and feedback, but yeah, would love to continue the conversation.
How does this information track with what the World Health Organization and other hospitals in different communities have been studying things? Does it track with what others are seeing through other lenses as well, or does this shows pop out something different from what others are seeing?
It is, so I don't know about the World Health Organization, but there have been, again, so there have been a couple of interesting studies that look at essential workers, frontline essential workers, and death rates among different sectors of essential workers, and showing that people who worked in food sector, hospitality, manufacturing, construction, how they had higher death rates, reflecting kind of some of the poorer sectors, the poorer segments of essential work, right? That had fewer protections and that kind of thing. And then there was another interesting study that looked at the effects of inequality on COVID outcomes. And so I think it does track with what others are finding. Again, how we had to construct this, because the CDC doesn't actually have information on income or poverty. We had to kind of layer it. We took what the CDC gave us in terms of death rates and the demographics and all of that, and kind of layered it with county level information from the census and other places on income and poverty. And so you had to kind of construct this database. And this is what others are doing too. This isn't kind of a new methodology. We just asked a different question.
I see Roger, and I think Lyle had a hand possibly raised, but yeah, we can go like that.
Just a comment, I would guess that also overlaps. Some of the worst death rates would overlap with obesity. there is an obesity epidemic in this country. And it does also focus on a lot of those southern counties, I think, that you looked at with Deep Purple in Mississippi and Alabama. They have tremendous obesity issues down there, which also relates to general health, knowledge about health, education, and other factors, I think, too.
Right, often access to, supermarkets that have, healthful foods and things like that as well.
I think it's also no coincidence that it's a lot of southern states that haven't expanded Medicaid, and just access to healthcare in the South more generally is such a major issue. And like you're saying, there's so much to be overlapped for sure.
One of the factors that we looked at was, another thing that the CDC kind of leaves out, so it'll report kind of racial demographics if a county has more than 100 deaths. And so we know the racial demographics of larger counties, but we don't know, the vast majority of small rural counties. We just don't know who's dying in them. We don't know what's happening there. This kind of blind spot on rural and small counties is really stark. And in fact, when we divided the counties into groups of 10, we had to kind of make the populations even across the different groups. We had to aggregate, so there are 3,200 counties in the country. We had to aggregate almost 1,000 of them in the kind of highest poverty ones, because so many of them are small counties, small rural counties that's how we had to kind of tally all of that up. Poverty, lack of infrastructure in these smaller towns, rural counties is another kind of theme that we're seeing, and that we haven't been really paying as much attention to as a country.
It was an interesting dynamic, the difference between the first and the second outbreaks. The poor did better in the first outbreak, and I'm trying to figure out why that.
So if you think about it, I mean, anecdotally, so there was a report, an article that came out from a Texas paper, I can't remember which one, after this report was released. I talked to public health experts who basically said, well, that makes sense, doesn't it? If this was brought to the country by people who maybe were exposed to it elsewhere through travel, right? And brought it here, and then we're kind of shielded from it as it continued, because they could work at home, they could shelter at home, they could have others deliver their groceries, or whatever it is that people needed to do. But then reflecting also that there was a whole bunch of people who that wasn't possible for, and so as schools closed, as the front-facing sectors of the economy were closed, but still had a bunch of people. I mean, just the number of essential workers who were just put at real risk, and the concentration of those workers in health, food sector, all of these, the produce packers, all of that, who didn't have a chance to stop working. I think that's part of what we also see in that graph.
Makes sense. The poor Kyle?
Yeah, you've actually answered my question, but since I raised my hand, everybody saw me raise my hand, I wanted to say, I was thinking the essential workers, I was thinking of people who have to work to put bread on the table, and they can't work from home. They don't have that option because the factory, the meat processing, the poultry industry, whatever it is, demands that they come to work. And that's some of the obvious inequities, as well as all the things you have mentioned. You mentioned it very, very well. You mentioned exactly what I said, so thank you.
So what report are you working on next?
Well, that is to be determined. At this point, what we are all focused on is getting to DC in June, because there is a lot on the line for poor people, for people of conscience in this country right now. And, as we lead up to the elections in November and beyond, things are really hard. But, even tonight, Reverend Barber and Reverend Liz, they were on a live stream, with people out of Texas who are committing themselves to joining this campaign and to building out the power that, to confronting this violence with something that is fundamentally different, that is welcoming of everybody around this agenda, right? And around an agenda that prioritizes life, and peace, and not violence and death. And so I think that is really kind of the, our North Star for these several weeks. And I think after June 18th, depending on what we're able to accomplish at that time, what kind of gets tapped into and unleashed from that moment, I think that might help us, that might, reveal to us what our next steps will be.
I have a question. The figures of the workforce that you showed on the tables that later, do they include the domestics that work and probably are not part of the tax base?
Yeah, that's a great question. I don't know actually how informal workers or kind of cash economy workers are reflected in those numbers. I don't know about that. But obviously that's another huge sector of the economy, huge sector of work that is getting more attention, but certainly not enough attention or resources.
Well, I was contacted through the computer for an organization that's advocating. Have you seen that? Advocating for domestic workers? And I even went and signed up to give a monthly stipend to them. I don't know what.
Do you remember the name of the organization?
I will find it and I will somehow get it to you. Okay. I will,
okay.
Because
please, yeah.
They take it out of my monthly, allotments.
Yeah.
So I will find it, and the group that is located, I think this is located here in Delaware, if I'm not mistaken. So I will get it back to you. Okay.
Okay. Yes. Please let me know. There are some really good organizations that work with domestic workers, but it'd be good to confirm that and either connect with the group that contacted you, and see what they're all about.
So just to build more on June 18th and actually tell you a little bit about who's here. So Lucy, who just spoke, and Jane Palmer, who's here, participated in the March in DC pre-pandemic. I guess that would have been 2019.
Yeah.
They were down there. Earlier, in some of the smaller marches that we were doing in the past 6 months or so, Bill Nace, who's on here tonight, went down with me on one of those bus trips. So he's been down there. And Lyle, who asked one of the questions, and I are currently on the coordinating committee. So we're working hard on getting folks organized on the buses. But for everyone else on the call, please do know that on June 18th, we're trying to get anyone and everyone organized from Delaware to go down to DC for the day. There will be buses leaving from Wilmington and other locations throughout the state. But for us, sorry, Norm, you guys, I guess there are a couple buses down in Sussex as well that are being organized. I think Seaford and Georgetown, there are also buses. But they'll be leaving early in the morning, go down for the day, and then coming back late afternoon. So you can get to the links you need to sign up for that through the Poor People's Campaign website that Tony put up earlier. If you go to that page, you can't miss it. It's all over the homepage saying register here, and it will take you through step by step, including then the rally bus page where you can sign up for what city you would want to get on the bus. There is a $40 charge for those of us who can afford it. There had been, through contributions made to the National Poor People's Campaign, there had been a code that was available for those who needed to be able to ride for free to put in a code and do that. That code has expired as of this week. So for our Peace and Justice Work Group, I will give you a heads up that we are looking to raise some local funds so that we can create a new Delaware specific code to continue to allow those who have not registered yet but still want to register to be able to get a scholarship to have that $40 paid for them. So I throw that out there. We can have that discussion later, but maybe our Peace and Justice Work Group would like to make a contribution to that fundraising effort that we'll be launching. So how many people are going to go down with me on June 18th? Who's coming with me? Okay, you have a few of us. All right. Good to see. Good to see.
And I'm actually raising two hands because I'm bringing somebody with me. So we do.
All right. All right. Nice.
Speaking as someone who was around during the original Poor People's Campaign back in the day, it was not so visible how in reality all of us are impacted by these issues. And I think one of the things that is apparent through the work that you've done, the work that's been going on, is that this is not something that we can just say, oh, it's those people. It's, you know, it's like the theme in Heather McGee's book, The Sum of Us. We are all impacted by this, and we all have a stake in making it right. And I am just delighted to see the data that you shared, and I am looking forward to clicking on a whole bunch of things to learn more. So thank you so much for putting this together. I think it gives us the opportunity to appreciate that this is not an us versus them thing. And that's so important. Thank you.
Does anyone else have any other questions about the reports or June 18th that we can answer before we say our final thank yous and goodbyes?
I just wanted to thank both Tony and is it Shailly? Shailly. You were both so engaging and so helpful, and you have so much information. So I just appreciate that. Thank you.
Good though for me.
And this event is recorded. It will be on the Westminster Presbyterian Church YouTube channel tomorrow. So if you know of anyone that wanted to be here or that you think would benefit from having this information, please direct them to our channel and they can watch for themselves. Or if you missed something and want to revisit, will be available for those of us here as well. So thank you all so much for being here this evening.
Thank you again,
Thank
Shailly
you
and
so
Tony.
much.
Thank you. Thank you all. See you in
Thank
DC.
y'all. Yeah, June
See you
18th.
in DC. Good night.
Good night.
Good night.